All
Hey,
right.
Dino.
All right.
So,
How you doing today?
you know what, man? I had a fantastic day. I went diving.
You went diving.
I did 2 dives today here in Barbados, and it was beautiful. I was down 70 feet. One of the spots we went to was a wreck, which was really interesting to swim in and out of that ship that was just all over the place.
Yep.
And the other thing I did, the other place we went to was a reef, and I saw these triggerfish. You ever seen those ones with the teeth?
Yep.
Man, that's bizarre. And a ray, and I saw a black lionfish.
Very cool.
You ever seen one?
No.
Wow. You live in Roatan.
No.
No, you live.
Puerto Rico.
You're in Puerto Rico.
I'm in Puerto Rico. Not right. I'm not Rotan yet, but I'm in Puerto Rico full time.
Are you thinking of joining Jeffrey in Roatan?
I'll definitely be going down to Rotan to check it out this year.
I am hearing more about Roatan on this ship, on this cruise, with these people than I've ever heard about it before. And I literally just fell in love with it over the last few months because that's where I got my certification.
Yeah.
And that's where I did my first 16 dives.
Beautiful water, beautiful island,
Yeah.
great people.
Yeah.
Largest living reef outside of Australia. What more can you ask for?
Not a lot, eh?
That's right.
So is this one of your goals, is to end up living down there?
No.
You're okay with Puerto Rico?
I love Puerto Rico.
Isn't it cost more to live here?
I don't know.
You don't know or don't care? Weather's comparable.
Right now for what I'm doing and my mission in life,
Yeah.
because I'm building a legacy business. I'm on a
But
mission.
you've been doing that 15 years.
I'm not done yet. I'll be
So
done.
let's-
I'll be done shortly.
Since we're at the point now where
Yeah.
we're starting to talk about what it is that you do, let's start with, like, I already know that you started off as a nurse practitioner and that you became kind of unhappy with the system that existed around you. And so you created a whole new system, didn't you? You didn't wait for someone else to do it. You just said, there's a problem here and I'm going to fix it. What did you do to fix it?
So,
Well, first let's identify what the problem was that you found.
which one?
Well, no,
there's a lot of them. Okay, so first off, the problem in healthcare is there's a lack of providers. The system to make doctors was purposely designed to only have so many seats
That's
to
true.
create only so many doctors.
You
Well,
don't think they could build more universities?
What for?
They don't want to
They don't need to build more universities. What they need a better system. The system hasn't been updated
Right.
to create doctors in 50 years. Well, 50 years ago, we had half the population that we have.
Well, we had half the doctors too.
We had half, but no.
Hasn't the ratio changed?
The rate, no, because you can only create X number of doctors a year
Yeah.
because it takes so long to create them. But demand has been going up and up and up,
So
and the
it's what,
population is
7,
getting
8
older.
years after high school to create a doctor?
7, 8 years after college.
What do you mean after college? Don't you have a 4-year degree and then you go into medical school, which is another 4 years, so 8 years?
And then you residency, where you
But
actually.
if you're a GP, do you have to do residency?
Yes.
All right, so that's 9 years.
No, that's another 4 or 5 years, depending on the
Not to
residency.
become a general practitioner.
Yeah.
In the States, you have to do 4-year residency?
Yeah, because general practitioner, it's head to toe, womb to tomb.
Okay.
You got to understand emergency medicine, psychology, psychiatry.
Yeah.
You got to understand pediatrics, women's health, womb to tomb, head to toe. And
You have actually
in all
met
different
doctors
ages.
that understood all that stuff?
I've met some incredibly brilliant people.
Okay, but most of the doctors I've met don't understand most of that stuff. They Google it.
Yeah. Okay. So what it comes down to is, in every profession,
Yeah.
you have the rock stars. Then you have the middle of the road, which they're good.
Yeah.
They got a lot going for them. Then you have the ones that are enthusiastic.
Sure.
Try to avoid picking an enthusiastic doctor.
Okay.
Okay.
Yeah.
But so then, as I was a nurse, and I wanted to become a nurse practitioner,
Yeah.
and I needed that hands-on training to apply all of the book knowledge.
And nobody had it for you.
Right. And because, for lack of a better description, I have a bat and balls.
Yeah.
Okay. I needed a women's health rotation.
Okay.
I needed to learn how to do a pelvic exam, do a pap smear, do all of these
I
things.
did that in college.
But on a different level, But and the problem is that's what a lot of people think.
Yeah.
oh, well, you're going to the gynecologist, you can look at women all the time. No.
No.
No, this is a job. This
I
is
got it.
you know, that's why I tell people, it's like, look, it's a job. I'm not there for my pleasure. I'm there for your health.
Get on.
Right? Okay. So this was going to delay my graduation by 6 months.
Yeah.
And it was going to cost me 6 months of salary that I would have earned.
So right
and
there,
being a business person with half
epiphany.
a freaking brain,
Yeah.
I'm like, well, this is.
If it's
Can I
affecting
curse on
you,
you?
yeah, you can say
Okay.
whatever the fuck
Well,
you
this is fucking stupid.
Yeah.
Okay. So I called the dean of my school at home.
Yeah.
Found her phone number.
Yeah.
And I let her know exactly what the hell was happening, why I felt. It's like, I'm giving you $10,000 a class. I went to private school that I paid for.
So you found the problem was that they didn't have the system in place to teach you beyond the degree. So
no, they couldn't even finish the degree program.
Got it. So you came up with that, because I want to get to the.
Okay, so I came up with a program that professionally manages the clinical training and the application of your book knowledge to direct patient care.
The practical side.
The practical side,
and
the clinical side of learning how to be a patient care provider.
Right, how to care about people.
Well, no, there are doctors that are incredible that don't care a damn about people.
Okay.
Okay, the compassion
but you're
part.
not saying you don't want your doctors.
I want our doctors, our nurse practitioners, to be caring, compassionate, and competent.
Right.
And not in that order. Okay.
And this is the stuff that is offered by your organization?
Yeah. So we started off by creating a program called ClinicalMatchMe.
Mm-hmm.
Literally, it's what we did, clinically match somebody to a training program.
Swipe left, swipe right.
That is the best analogy.
Yeah.
Literally, I created an entire industry as a disruptor.
Yeah.
And 15 years later, that has morphed into PRHCC, which stands for Puerto Rico Healthcare Centers.
Yeah.
And it is a model of not only providing increased access to state-of-the-art healthcare in the communities where people live, but at the same time, utilizing those community health centers as teaching facilities to train the next generation.
But when you and I
providers.
talk, you're in 50 states.
Yeah, we've been in 50
states. How can you use the name Puerto Rico Healthcare Centers in Texas?
Well, because our foundation is PRHCC Foundation, and it's a model that I developed to solve the healthcare problem in Puerto Rico. Mm-hmm. And so I named the model the PRHCC model, right? And
then every state has its own actual name under a different corporate name?
No. I launched in all 50 states 15 years ago.
Okay.
My network is in all 50 states. I've got doctors, I've got students, I've got facilities, I've got schools, universities. So now what I'm adding to the mix is the nonprofit side to facilitate the whole program and add scholarships to create these providers in the states.
See, this is the brilliant part of your system. You're not only teaching them, but then they commit. From the way I understood, I'm going to jump ahead a little because I want to make sure we have a complete conversation this time. So they commit to a certain period of time. They're working for a doctor who's going to mentor them and teach them the things that they need practically. Then their commitment, somehow there's money that flows back to the foundation, which then sets up the scholarship for the next generation. Is that how you set it up?
That's a 20,000-foot view. So
bring us down. Bring the lens
bring it down. There's always an ask. There's always a give.
Yeah.
Okay. You want a scholarship that's going to pay for your tuition, your housing, your training, and your everything.
Yeah.
To help you go from a student to a competent healthcare provider.
Sure.
And then our ask is that we give you a job, that you take that job for 5 years, be a contract, and you provide healthcare services in underserved populations to underserved communities for those first 5 years, but you're getting paid going rate or better because you're better qualified than the average new grad.
Right.
And so not only do we help gain a scholarship to create you into a healthcare provider, we give you your first job.
Right.
And because the training happens in the facility in which they can be hired, they learn in the culture of medicine of that facility, plus all the additional teaching that we give them.
Now, do you vet these facilities? Because you don't want to send a kid to some crazy, doctor that's actually... I personally had the experience of working under an incredible veterinarian, and then I had the experience of working under a nutcase. And I can tell you that had somebody vetted this guy, I never would have worked for him. He was literally a nutcase.
Yeah.
So do you vet the doctors?
We vet the facilities and the doctors who do full credentialing, full background. But more importantly, these are all a lot of the teaching facilities, not all, but a lot of the teaching facilities are what are called FQHCs, federally qualified healthcare centers.
So the government's involved with paying for this?
Yeah. Yeah.
So
Donald Trump, love him or hate him.
Is it through the federal government or the HMOs, or how you funded?
No, the HMOs blow. So Donald Trump, love him or hate him. Okay.
Yeah.
No matter what side of the aisle you're on, there's no in between.
Okay.
Okay. He created a program under the big beautiful bill called RHT, the Rural Health Transformation Program. And
what's that mean?
He funded $50 billion over the next 5 years.
Yeah.
Divided up into the states based on population and need to create a sustainable rural healthcare workforce, so that the American population that live in rural America or in the urban areas that are underserved, such as homeless people who don't have access to healthcare easily, or if you're in the middle of nowhere and you don't have access to healthcare easily, that you have access to state-of-the-art care through this program. And my program, we're already doing this. We're already creating healthcare providers. But it matches exactly what the goals are stated for this program. It's not a forever program. It's not.
No. I now got the gist of what it is you're doing. So what's the next step for you?
Get off this boat.
No, I mean for the organization.
For the organization.
You been drinking, buddy?
Not yet.
All right.
Not yet.
I want to make sure I caught you before.
I'm still catching up on my meetings that I didn't get done yesterday.
Dude, you've been at this 15 years. You got 50 states, then over 25,000 graduates.
28,000.
28,000.
Yeah, over 28,000.
So, even though I joke around and you're a man of substance. You've actually accomplished a lot. You are truly a man of substance. And I love the humility and that you can joke around and
somebody said to
laugh
me,
at yourself.
Dino, you have reached the point of self-actualization.
Yeah.
I know who I am.
Interesting.
I dress how I dress.
Maslow's hierarchy of needs.
Yeah. I'm not building a business.
Right.
I built a business a long time ago.
Yeah.
All a business is a job that you pay yourself, work for yourself harder than anybody else.
Yeah.
But when you're building, right now I'm building a legacy.
Yeah.
Okay. And
you want the world to remember you in what way?
I want them to remember me as a person who left it better than when he came in. Because, our program, whether somebody donates $10 or $10 million.
No. Answer the question. How do you want to be remembered? Because you're talking about legacy. Legacy is a personal thing.
I did something.
Yeah.
I did the right thing because it was the right thing because I could.
Are people literally better off now that you came up with this idea than they were had you not?
People would be dead had we not created the providers.
It's that impactful, is it?
Yeah.
So you've created a lot of people that are a lot more competent and a lot more capable of actually having conversations with patients, listen to their needs, and to explain to them what they need to do so that they can get healthier.
And it's not just getting healthier. Sometimes in medicine, we haven't come up with a lot of cures for certain things. Sometimes it's a matter of quality of life.
Yeah, that's actually the bigger thing.
And sometimes it's a matter of reducing the advancement of that disease.
Sure.
Right? So if we can catch something early through education, through screening, all right, I can put off into the way, way future, like for, lupus, for instance. If you catch lupus early, okay, the reason a lot of times people die from lupus is from internal organ damage. The body attacks itself.
Lupus is an inflammation, isn't it? It's basically an autoimmune disease.
It's autoimmune. The body attacks itself. Okay. But in the advanced stages, it destroys your.
It's at the
organs,
genetic level, though.
But if you can catch it early, you can manage the level of damage it does to the body, so that instead of a young woman or man dying in their 20s, they may live a full life and die as a grandparent.
This is personal for you because your wife has lupus.
Yes, she does. Yeah.
And is her quality of life better now?
Hell yeah. She almost died the week before we got married. She was in intensive care and needed blood transfusions.
Okay, what's her blood type?
Red.
Was the blood type she had readily available?
No.
So that was actually frightening.
And then because of having antibodies and the chance of a serious reaction and a chance of a fatal blood reaction,
sure,
we had to make sure that the blood was properly cleaned, properly washed, properly, filtered.
Yeah. So that's standard procedure now.
No, it's not.
Blood is filtered and it's standard.
No. I mean,
Canada it is.
Oh, no, I mean it's filtered, but it's not. It doesn't go through all of that.
Right.
That needs to be done if you have antibodies, because the reaction can be fatal. And and this was literally the week before we got married. And
well,
and
bless her that I met her and she's an absolutely lovely lady.
Yeah. So
I'm gonna actually have a conversation with her another time.
It's I knew she had lupus before we got married. I didn't care because we're soulmates. And
she's from Africa. She's Nigerian, and that disease is almost always fatal there, isn't it?
Yeah, because it's misdiagnosed a lot.
And they also don't have
they don't have access to the care and the level of care that we have. And let me tell you, there are areas in America that are no better off for access to health care than somebody in a third world country. Or not, it's that simple.
So do you think out of the 28,000 or so students that have gone through your system, that they would be more knowledgeable, smarter, and more capable than the majority of other doctors, nurse practitioners that exist that without your training?
Well, I'm gonna say this. Majority of our students are nurse practitioners, not medical doctor students.
Of course,
So, and we don't get the in-depth level of training a doctor does.
No.
And we're not trying to be doctors. But the nurse practitioners that have come to my company and that are going through my program that I created, are better off than anybody else that graduates without getting this additional
Now,
training.
you charge a lot of money for this service.
Yes, I do.
So
I spend a lot of money on it too.
I'm assuming you would. Do the doctors pay to have these people work there?
No.
So you don't get a cut of bringing in somebody that's competent to work in their clinic?
No. So the way it works is the clinic signs up with me,
right?
And we transform it into a teaching facility.
Got it. And
then we pay the facility, we pay the doctor to teach these students.
So then the doctor is an educator of your university.
Not a university.
Well,
my program.
Your educational system.
Yeah, my educational system.
So then the student just carries on being a student, and so they have like 1 or 2 more semesters of school, but now in practical, and they're being paid during the time that they're there.
Correct. Yeah, we get them a stipend. The scholarship will be covering their housing. It covers a lot. It covers a lot.
So you came on this cruise with a goal in mind. You need to raise money, don't you?
Well, I needed another $25 million.
Yeah.
And then I also was looking for other companies in the healthcare space that could either have a product or a service that we could incorporate into teaching these young people and molding their minds to be ready for the future.
What do you need $25 million for?
Match money for grants.
Well, because $25 million is such a small amount in the medical world.
It is, but when you're dealing with grants, the grants will give you 75% or 80%. Yeah. You got to come up with the rest.
But don't the kids pay their own education?
And
that's still not enough to cover your nut.
No, not even close. Not even close.
Maybe you need to rework the model.
No, the model works because I don't need to make a fortune off of each person that I train and create.
No, I understand. But if you're training people and they're paying you to be trained, and the doctors are paying them to have an education, basically the doctor is paying for them to pay you.
Well, no. Okay, so the money flows from the foundation.
Yeah.
Okay, it goes into the foundation via grants and scholarship and donations.
Yeah.
And then it flows out to pay the facility and pay the doctor to do the training. It goes out to cover the tuition and the stipends and the housing for the student.
Got it.
Okay, and then after the student graduates and gets board certified, out of the new revenue that they generate at the facility that they're working at, they pay back the scholarship money into the training program.
And that takes about 3 years?
That goes 3 years, and then that trains the next student.
Okay.
So it becomes self-funding.
What do you need the $25 million for? So if you come to me right now and say, I need $25 million, I'm going to say, well, what do you need it for?
Okay, so right now we're up for a grant,
Yeah.
a $50 million grant. We have to match. We have to have $12.5 million sitting in the bank.
Got it.
So that they'll give us the other $77.5 million for that.
Okay.
And that's to get 2 locations up and running.
Yeah.
With everything going here in Puerto Rico.
Okay.
And then the other thing that we're doing is we're having to hire more bodies, more people to manage the overall scholarship nonprofit program, which is growing rapidly.
Right.
So that we can have the right
Is
people
there a medical
in place.
school in Puerto Rico?
There's a couple medical schools in Puerto Rico.
All right, but most of the medical schools that you're taking your kids, or like you're, getting your students from, are coming from where?
We take students from over 650 universities in the U.S.
Really?
Yeah.
So, is your program well known amongst all those schools now?
They either love us or hate us.
All right.
Yeah.
The question then would be, if a student is graduating as a nurse practitioner, how do they hear about your program?
Well, we actually just started advertising a few months ago after 15 years.
Right.
Because we wanted to make sure that, get the word out. But it's always been word of mouth. We've built the entire...
Wouldn't it be better that the professors or the school itself shows them that they have this?
Who do you think created the fucking problem I solved?
I got it, but somebody has to be reaching out to these kids that are coming out. What about the doctors that are hiring? Wouldn't they be also saying, okay, when you make your
my God, the doctors are doing the hiring. You know what they say?
What?
You're producing garbage. Okay?
The
schools are producing garbage. You need to improve your program so that I don't have to hire your graduate.
No, I understand, but
and spend a whole year paying to train them.
What if the doctor said to the applicant, do you have the PRHCC certification? What would happen then?
I would have a waiting list longer than what we intend on having now.
You have all these doctors in your network. Why not just have them put it on the application form?
Because there are certain... Okay, it's not for everybody.
I'm not saying it is.
No,
it's a question saying, are you PRHCC certified? So either they're going to say yes, or they're going to say no, or they're going to say, what the hell is PRHCC? In which case, they start looking for you, and now you've got a lot of advertising at that point.
So word of mouth,
But do you get what I just said?
The disruption we're doing in the industry right now.
Would it work?
Yeah, it would work. It would work, but let me tell you what really would work.
Are you willing to try it in 1 or 2 states?
No. I'm
not even willing to try it?
Not even willing to waste the time. Because I know it would work, but what works better is producing the results and showing people, and then taking that to the national level.
No, I get it, but you want more of these kids to be aware of the training that you offer, and they're not even aware of it, a lot of them. And you said you want to make a difference. So when you make a difference, you got to have more people actually taking the extra training. And if the only way they can find out about the training is if when the doctor that they're applying to says, are you PRC?
Our training is prior to graduation. Right. So they're not going to get the job and even see that until after they finish their program and graduate.
No, I get that. But they also would, when they're making their application, a lot of people apply for jobs 6 months to a year before they finish their education because they know they're going to be completing.
They're too late at that point.
They're too late.
Yeah, we need you the whole year.
Really?
We need an entire year.
In their last year of school?
Their last full year of school.
How do they do your training and the school training at the same time?
That's why we give them a stipend, pay for their housing.
Yeah.
That's where the scholarship to cover housing, stipend, food, malpractice insurance.
So really, actually, if they're looking for scholarships, then that's the way you get them.
Yeah.
They
come to us. And here's the reality. We don't have enough slots to train all 35,000 active students right now. So it's a competitive program to get into.
So you're not struggling to find students?
No, not at all.
Okay.
Not at all.
Are you struggling to find doctors that are willing to hire these people and train them?
No.
Okay, so where's the weak link?
I'll tell you, the only part we haven't figured out yet is how to maintain the legacy after I'm gone. Because
you have no kids.
Oh yeah, I do. We have lots of kids. But what it comes down to is when you build a legacy style type of program or business.
Yeah.
When business is always an exit strategy. right?
Yeah, that's generally.
But if you're building
You're
widgets,
like 90 years old. Aren't you ready to retire?
are you kidding?
I'm sorry, how old are you?
I'm 57.
57.
Yeah.
So you still got a good 20 more years of work left in you?
No, I've got about 5 and then 15 healthy years that I want to be able to enjoy life with. But no, what it comes down to is
with your health?
yeah, absolutely.
Good.
Absolutely.
Good.
But the exit strategy with a normal business is acquisition, public,
Sell it.
sell it.
Sell
right?
it. Yeah.
But when
Cash
you're
out.
when you're building a legacy that deals with the creation of healthcare providers who have people's lives in their hands, and you have to do it a certain way so that they are truly competent and capable to do that.
You want to know they're doing it for the next 20 years the way you designed it.
Or longer, yes.
Yeah.
So that's the part I'm figuring
you
it
won't
out.
be able to think about it after you're dead. So the point is, as long as you're alive, you want to see that it keeps growing in the direction that you've taken it. And you're hoping that one day someone's going to come along and come up with an idea that'll make yours even better.
Absolutely. And I've met some people on the boat that have come up with ways to make it better already.
And you're open to some shifting.
I'd be an ass if I wasn't.
You know, I'm glad you said that, because that's one of the biggest problems entrepreneurs have, is they just think they know every fucking thing themselves. And if somebody else thinks of it, then they can't take credit for it, and then it's not their project anymore, and blah, blah, blah.
Now you know, we've had a lot of conversations personally on and off camera.
Sure.
Have you ever heard me talk about I and my and me when it comes to this?
No. It's a we.
It's a mission.
You've got a whole bunch of people that you give credit to, and
I've got a hell of a team.
Yeah.
They make me look good.
Well, that's that's important, and obviously you look great because you got a Nigerian princess bride.
Hey,
so I don't know how you did. That's something you're gonna have to explain to me. How? I mean, dude. Anyway,
I married the girl of my dreams.
Yeah, and she loves you. I talked to her, and I was like, okay, she wants her citizenship. No, she truly actually loves you.
Yeah.
And I'm going to interview her at one point because I want people to meet this woman. She's an incredible lady.
Yeah.
And so I'm going to have another episode in which I'm going to have a conversation with her behind your back.
I don't care.
You can watch the video.
Ain't nothing she can say to you that would embarrass me.
I know. And I might even put the two of you together, and we might, and just because I want people to see how this kind of a relationship can work, because people are going to be questioning it your entire life, and I'm sure they already have.
I love it. It's like pick one. We trigger everybody.
Of course.
I'm from America. She's from Nigeria. I'm older. She's younger. I'm white. She's black. I'm Italian. She's Igbo.
She's beautiful.
She's beautiful. I'm me. Okay? And so pick one.
Yeah.
Right.
Yeah.
And she is successful in her own right.
She is actually
very successciel.
Yeah.
She just got offered the CEO position of a company by the way in the last 24 hours.
Wow.
And she's gotten featured in a magazine.
Yeah.
While we're on the boat.
Yeah, I know. I saw that actually.
And another magazine cover.
Yeah.
Last week.
Yeah.
And her fashion designs are off the chain.
Listen,
people love.
Since we're mentioning this in closing, I'm going to get some of those images from you so that maybe I can stick them in the podcast.
Hell yeah,
and
man!
So that I can, while we're talking, we can flash these images when I figure out how to do it.
But I want to make sure that people understand that this is not about me.
No, we get that.
But
it is a little bit about legacy.
It's about legacy, but I used to make a difference one patient at a time.
Yeah, now you're doing it a million
now
at a time.
I make a difference one healthcare provider at a time.
Yeah.
And then they see patients for an entire career.
Yeah.
And I help do that.
Yeah.
How cool is that job?
That's a good
That's
thing.
not even a job, right?
That's a calling.
But how cool is that? If that's what you get to do, and you get to do really good things, you get to get paid well for it. And you get to enjoy your best life with your soulmate.
So the people that are watching right now, what do you want from them? Need anything from them, or you just wanted them to know that what you're up to, and you know, is there anything they can do to help contribute? To what you're doing?
So if they want to donate money to the prhcc.org or PRHCC Foundation, give that information, and use our program as a multiplier.
And you're a 301c type
501c.
501c. That's it.
Use your philanthropic donation. To help create a healthcare provider, and that will be paid forward with every patient that they take care of for an entire career.
Now, is this like a monthly donation they need to make, or just an annual? So it's not like Save the Children type thing.
What the hell is that?
You know, where they.
Oh yeah, with the fat white chick
Yeah,
that's
yeah.
walking around in the $1,000 dress, going, "Look at these poor children. Send your money."
Yeah.
No.
Yeah.
Yeah, bullshit. No, this is if you desire to help solve the problem, be part of the solution.
Right.
Donate $10, donate 10 million.
So that's the charitable side. And if you happen to be a student watching this and you look for some training, or if you happen to be a healthcare provider and you want to find some smart kids that got more on the ball.
So if you're a young
reach
person, you're thinking about what do I want to do with my life, thinking about becoming a nurse or a doctor, look us up and come to our program. Let us help along that way.
All right.
If you're a CEO or a hospital or a healthcare organization, you need the most qualified hiring funnel that you could ever hire from. Join us and become a teaching facility and help be part of the solution.
Sounds good.
Other than that, man,
let's leave it at that, man.
Stay healthy.
Yeah.
Enjoy life.
Yeah.
Make money. Do really good things with the money you make, and then have a hell of a lot of fun in life.
Learn, earn, return.
You call it yours, I'll call it mine, my friend.
Thanks, brother. I appreciate you coming.
It's a pleasure.